Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today we will discuss emergency department coding guidelines with few simple practice questions. So let's get started. So firstly understand what is emergency department. Okay, so a ED is a hospital based facility providing an unscheduled episodic services for immediate medical attention, and it operates 24/7. Okay, so it remains open all the time. Okay, so that is the main difference between outpatient or office setting and hospital based facility. Okay, you can just take an example. Here in India we will have the hospital and we will have the general clinics. Okay, so in the clinic what will happen, the provider, this is completely physician based, clinics are physician based, so he will come at 9 o'clock in the morning and he will open the clinic, and same way he will close his clinic in the evening 6 p.m. or sometime in the night 10 p.m. Okay, so there will be the daytime schedule will be there for the clinic. But when you take hospital will remain open all the time. Okay, so they will not close that hospital, it will remain open, so that emergency department should be associated with the facility. Okay, hospital. So here they are saying ED is an hospital based facility providing an unscheduled episodic services. Okay, and please one more point you remember, as soon as you see emergency department, do not get conclusion like the patient is getting admitted. Okay, it's not always, it doesn't require that that patient needs to be admit if is seen at emergency department. Okay, few people will be like maybe they are getting chest pain, or maybe the patient is suffering with abdominal pain and they are coming in the night. Okay, so in the 11 o'clock the patient got abdominal pain, so he cannot go to clinic, he has to come to hospital. Okay, so there are some simple cases and there are some complications, complicated cases. So we have to refer the question thoroughly. So you can see the codes here. Emergency department code starts from 99281, 282, 283, 284 and 285. And if you see 99281, so this code is for evaluation and management of patient that may not require a presence of physician or other qualified healthcare provider. Okay, so this is for nurse visit, and this like the simple conditions that can be treated uh, from the nurse, so where physician is not required. Okay, in those cases we will bill 99281. Okay, and remember, on the same date of encounter or in the same visit, after nurse, if physician is evaluating, then we will bill for physician. Yeah, that ED physician. Okay, in the same visit we should not use nurse visit code on also provider visit code. We have to go with, if nurse is treated, just go with the nurse visit. Okay, and coming to 99282, 282 is for straightforward MDM, and 283 is for low MDM, 284 is for moderate, and 99284 is high MDM. Okay, and if you see here, we have to follow the sole guideline, that is MDM guideline. We follow medical decision making guideline and we don't have a time guideline which applies for emergency department. Okay, so this is a simple information about emergency department. So be aware about what is the difference between outpatient and emergency department. Emergency department will be, it's a unit, will be there in a facility, hospital based facility. So coming to coding guideline, so the first coding guideline is regarding new or established patient. So when it comes to emergency department, there is no distinction in the ED coding. Okay, so we don't have to check whether the patient is new or established. We have a set of code. Whether the patient is new or established, we will utilize those set of codes only. And next, if you see critical care services, say for example, a patient seen in emergency department, but the physician is performing critical care services. Okay, so if we meet the critical care service criteria, we can utilize the critical care codes. Okay, 99291 and add-on code 99292 is for critical care. We can utilize though that patient is seen in the emergency department. Okay, so there is a timing criteria for critical care. If the timing is like if they perform less than 30 minutes critical care, less than 30 minutes, then it is not eligible to code for critical care. If the timing is more than 30 minutes, then it's eligible to code for critical care. So you can go ahead and you can build the critical care codes. Next, observation status. Say for example, the patient came and seen in ED. After evaluating, the physician asked the patient to get admit for the further evaluation or for further treatment. So in that case, we have to go with the initial hospital code, initial IP service code. Okay, nothing but hospital observation codes. Okay, and then hospital inpatient or observation services, this is like same day admission and discharge. So we meet that 8 hours duration, stay must be 8 hours. Okay, and the patient should get admit and then he should get discharged after completing 8 hours. So then we will meet the same day admit and discharge criteria. So we can utilize 99234, 235 and 236 code range. Convenience visit. So here if seen for physician convenience. So as I said in the earlier, like if you take an example, outpatient office or outpatient setting, there it is completely physician based. Whenever that physician wants to that clinic to be open, he will open, and whenever that clinic wants to be closed, he will close the clinic. It purely runs on the single physician. Okay, so in that case, we will utilize our normal outpatient ENM codes 99202 to 99215. This code range. Okay, new patient or established patient we may have to check, and accordingly we will code the outpatient ENM code. And when it comes to time in ED, time is not a determinant factor for ENM levels in emergency department. Why? Because services often involve variable intensity and multiple encounters over an extended periods. Okay, so in the ED encounter, it's not a continuous services, it can be a multiple encounters. Okay, so that we cannot really depend on the time, and that is for variable intensities, and we follow only MDM coding guideline for emergency department. Okay, so these are the coding guidelines we have for emergency department. And next we'll see few simple questions. So the first question, a 45-year-old male patient in an emergency department present at 9 p.m. with mild chest pain and heartburn after eating spicy food. A ED physician performs a focused history and exam, orders an EKG, and determines it to be acid reflux. The patient is given with the OTC drug with the instruction to avoid spicy food and follow with the gastroenterologist. So here the patient seen in the emergency department. Okay, and what are the symptoms? Mild chest pain and heartburn. So the diagnosis is acid reflux. Okay, so it is acute uncomplicated illness. And again, if it comes to data point, EKG is ordered. So single point, we are getting minimal data and low problem, and the patient is given with the OTC drug with instruction to avoid spicy food. So OTC drug risk will be low. Okay, so if you take the PDR, problem is low, data is minimal, and risk is low. Okay, so you are meeting low medical decision making. So our level will be 99283. Okay, 99283 is low medical decision making in the ED department, emergency department. And second question, a 7-year-old boy is brought to the ED by his mother after cutting his finger while playing. A ED physician performs a focused history and exam and straightforward MDM, and cleanse the wound and applies the skin glue. Wound care instructions are given. So they have clearly given it's a straightforward MDM. So according to that, ED straightforward MDM code will be 99282. 99282 straightforward medical decision making in the emergency department. Code must be 99282. Okay. So next question, read the question carefully. 86-year-old male present to the emergency department with a severe chest pain and shortness of breath. Wife given history, and after thorough evaluation including EKG, chest X-ray and lab test, the ED physician determines that patient is experiencing an acute myocardial infarction. The admits the patient physician admits the patient to the hospital for the further management. So if you read this question carefully, here the patient seen in the emergency department, but after evaluating the patient, physician asked to admit. Okay, the physician instructed the patient to admit. So we have to code the hospital IP services code. Okay, so hospital IP first day services will be considered with the hospital initial service codes. Okay, initial service. So again, if you want MDM to be strict here, emergency department with a severe chest pain and shortness of breath, wife given history, so there is an independent historian here, and thorough evaluation including EKG, X-ray, lab test. Okay, we are meeting moderate plus history. This is category 1. Okay, with this category we are also meeting the independent historian. Okay, so it's together will be in reaching moderate data. And again, it determines he is having experiencing myocardial infarction. So we will be getting it's in high problem. Okay, it requires intensive care and workup. Continuous monitoring should be there. So considering all the aspect and considering the patient age, we will consider this visit as high level. Okay, the MDM will be high MDM. So for that high MDM, our answer should be 99223. Okay, 99223, and we are billing hospital IP initial code. Okay, so do not get confused by seeing patient seen in the emergency department. Don't go with the 9928 series, because in the same encounter they are saying the patient is admitted. Okay, so as the patient is admitted, we have to code hospital IP services. Okay, answer should be 99223. Okay, I hope the guidelines are clear, and that's all guys for today, and it was a simple topic, and in the next videos I'll try to cover critical care and other important ENM services. Thank you for watching. Please do subscribe to my channel, and please do share with your medical coding friends. Thank you.